I originally came to Dr. Furze because I had a sinus issue. It's a chronic issue I've had growing up, but also from a lot of sports injuries. My airway was really obstructed. And it got to the point over the years where, I was waking up at night and unable to sleep, waking up like suffocating, literally. And it got worse and worse, especially as the pollen seems to have gone up a lot in the summers. We finally decided to do something about it. Looked around as to who the best ENT was to do the work. So that's how I happened upon Dr. Furze, just doing a lot of research and speaking with people. So we had scheduled surgery, and he was booked quite a bit out, and that was post-COVID. So in between, when we had booked that surgery, I had an injury. I had an accident, cycling accident, to where I hit my head against a cinder block wall, cut the eye, and in the ER, when they stitched it back up, they just wanted to stop the bleeding. And that happened maybe 2 weeks before my scheduled sinus surgery date. So we went through the sinus surgery, everything went great. Because Dr. Furze does this area as well, we had talked about, when the swelling goes down, if it doesn't heal correctly, that he would be able to help me with that as well. So when it did heal, the side where the sutures had been put in, on the right hand side where the injury was, there was like 7 sutures. And the skin was really loose and hanging down. And that was due again to the way the ER physician had stitched it up. So much so that it actually put pressure down on my eyelid and it overhung the eyelid. So it was actually obstructing my visual path. Dr. Furze went in and he tightened that up. The goal was to stop obstructing my field of vision, but also then to make the eye symmetric again in terms of the folds. It's been 2 weeks since, and it's healed, well, I guess you can see for yourself. I'd highly recommend them to anyone who has ENT issues.